Hi, in this video I'll be discussing borderline personality disorder. I'm Anna Bednarek. I'm a clinical psychologist and director of Well Mind and Body Psychology. We're a practice focused on giving you the vital tools for a healthy mind and a healthy body. Okay, so let's get started. Borderline personality disorder back in the day was something that was considered to be untreatable. So part of why we're doing this video is to actually say, oh my goodness, how fabulous it is that so many decades on, we are now very much saying borderline personality disorder is something we can definitely treat and help people with. Primarily the biggest turning point came when Marsha Linehan in the 80s developed DBT as a skills training program. And what she really helped, practitioners understand and have greater empathy for, that we're now building more information about, is that there are key experiences that children need to have so as to form a stable sense of self and be able to regulate their feelings and form secure attachments in life. And when we don't have this, fundamentally there's lots of different things that can arise from this as someone goes on through various life experiences, but one of the things that can develop is borderline personality disorder. So what is it? There's 9 fundamental diagnostic symptoms that, if you're interested, I'll be doing another video later, so you can check out the link above. But for the short term, something to consider is that essentially what we're looking at is an experience where someone is finding things unstable, fundamentally. So meaning that relationships can be unstable, and mood can be unstable, meaning that things can fluctuate in terms of how we're feeling very quickly and quite dramatically. And our thinking and our behaviors can be really, sometimes erratic or sometimes spontaneous or impulsive and quite unstable again. And even a sense of self will be unstable, meaning that someone with borderline personality disorder will probably struggle to tell you what they fundamentally, who they think they are. And actually a lot of the time they're probably just trying to find a way to adapt and be almost like a chameleon to the people around them. Okay, so I suppose what you might find is there's going to be intense fears of abandonment in relationships. And, the classic kind of thing is, I hate you, but don't leave me, which is a book even out there on borderline personality disorder. There's going to be intense sort of mood swings at times, and sometimes anger as part of that. And those things can leave people feeling really confused. What just happened? Why is that happening? But not only that, but once those kind of mood swings or those reactions actually come about, the hardest thing, of all is for someone with borderline personality, they're going to find themselves actually stuck in that. And it can take quite a long time to come out of those things. So for me, as a psychologist working with people with borderline personality disorder, I may talk to them about the diagnosis, but fundamentally the most important thing is to destigmatize it. It is not a life sentence. It's definitely something that we can help someone navigate through, especially for consistent and supportive therapy. But also even from the DBT skills training groups, what's really amazing is you'll meet other people who are experiencing very similar things. Everyone's going to be very unique, but kind of experiencing similar kind of things and learning skills that can help you navigate your emotions, which is affect regulation, manage distressing situations, so distress tolerance, improve your interpersonal effectiveness, so improve your communication and assertiveness skills, and learn mindfulness as a way to drop yourself into this moment, center, and find ways to ground yourself in the here and now and not be as lost in the mind, thinking about all the steps ahead, all the time in the future, and also that time travel in the past. So I hope this video sort of helps just understand what borderline personality disorder is, help you understand that if you are experiencing any of these symptoms, it's definitely an amazing thing to try and seek some help and find a way to help yourself feel more centered and stable. Because first of all, it's most distressing for the person experiencing it. So I hope this helps you reach out, perhaps even talk about it, and definitely destigmatize borderline personality disorder. And if you're interested, we've also got some mindfulness meditation videos that you can check out as one of your first steps towards looking at what sort of strategies can help you with this disorder.